Hi, this is Dr. Jack Allergy. You can follow me on my YouTube channel, Dr. Jack Allergy. That's DrJackAllergy. You can follow me on Twitter at hashtag Dr. Jack Allergy, spelled the same, and on the app live.me, also Dr. Jack Allergy, spelled the same. Okay, so what I want to do today in this short video is I would like to provide viewers with technique as to how to perform saltwater washes as well as the nasal sprays for allergies and allergy symptoms. The technique is incredibly important, and a lot of times people just don't understand the correct way, and so they don't like the medication or the way it feels because technique is incorrect. And so the most important thing that we can do as physicians is teach you and show you how to do something. In the medical field, we do something, or we have a saying that says, see one, do one, teach one. Okay, see one, do one, teach one. That's an important thing that we need to have. Okay, so for nasal stuff, for seasonal allergies, hay fever, sinus infections, irritation, whatever, something that you can use, what I think of as a re-wetting or moisturizing solution, is something that you'll see in these types of bottles. I am not advocating for any specific brand. I recommend buying the least expensive that you can. This tends to be for kids, but can be for adults as well. All this is a mist, okay? All you're going to get with that is re-wetting or moisturizing of your sinus passages. You can do this 3, 4, 5 times a day. It's not going to hurt you. People who experience a lot of bloody noses, this is something that can be incredibly beneficial. Now, there are all different types. There's little squeeze bottle types that you can squeeze. This is not a saltwater wash. This is simply a mist and moisturize, okay? To decrease the congestion. Did you know that if it can feel like when your nose is so dry, you can actually be fooled into thinking that there's boogers and junk that's in there and you're trying to pick and you get nothing out? Try this. This can be very beneficial. All you do is put it inside the nose and spray. Don't jam it in sideways, straight up and down, okay? And then as long as you want, short bursts, long bursts, take it to work with you wherever you can. Moisturizing the nose is incredibly helpful. Anything you can do, a mist, the little squeeze bottle, anything helps. There is also something like this. This tends to come in a package that looks like this. I am not advocating for this company. I just like their products. Comes with a coupon in there, but it comes with this type of bottle, which is just your typical squeeze bottle, and it also comes with one packet. There is also something known as a Neti Pot, which looks like a little teapot. It's plastic and small, and basically you're going to do it the same way. You fill it up with the same solution. All you do, though, is you tip your head sideways with it up to your nose. I think of that as a low flow system. This is a higher flow system. You control the output. Now, a couple of things that are important. You fill this with 8 ounces of water. They recommend distilled. I don't use distilled myself unless you have well water or do not have city water, which is treated. Then you're going to want to boil the water that comes out of your tap. I put mine through the Brita filter. I've never had any issues, and I've done this for years. 5, 6, 7 years. I do them religiously twice a day. And when I have an infection or I'm really feeling congested or I'm feeling something come on, I do them 3 times a day. Okay, so saltwater bottle, this is what you need. This is microwavable, so you can sterilize this yourself. You can also put it on the top shelf of your dishwasher or top rack of your dishwasher. Okay, how do you use this? You fill this up with 8 ounces of either room temperature water, which is what I do, or water, and then microwave it. But be careful. Don't add the salt until after you've microwaved, and only start with a short amount because you really don't want to burn your nose. Okay. Fill it up with 8 ounces of water. Then you're going to add your salt solution. You can add your salt solution first. You can buy the packets. You're wasting money. I will tell you exactly what you need to make your own saltwater washes. This says iodized salt. I'm sorry, I don't have a bottle of the non-iodized salt. Buy the non-iodized table salt. Less than $1, 50 cents. Baking soda. Don't even spend your money on Arm & Hammer if you don't want to, unless that's all you have. This is product number 2 that you need. Tupperware container. That's what you need. I actually put a little desiccant in there that you can find in a lot of things that get shipped to us, or in a vitamin container, and that way it just keeps the moisture out. And then I have I use a 1/4 teaspoon, and I put 2 of those in there, but the correct dose is 1/2 teaspoon of this. What's the ratio? The ratio is a 2-to-1 mix. 2 parts to 1 part. All this is doing is decreasing the sting, okay? It does help. If you make your own like I did, I add 1 cup of this and 1/2 cup of this. I put them in the Tupperware. I shake up that Tupperware with the solution in there, or with the salt and baking soda solution. There's your mix. Don't spend the money. 1/2 teaspoon is all you need. Okay, technique. How do we do this? I like to tell people, remember, think about your diving. Like you're diving into a pool. How do you dive? You lean forward. If you don't want the medication to go up your nose and down the back of your throat, lean forward. When you're doing a saltwater wash, you actually should be over a sink when you do this. So you unscrew the top, you add your salt solution, you add your water, and you cap this, obviously, and then you shake it. Shake it up, okay? That's important. Make sure it's mixed together, okay? Then you're ready to go. Now, what do? Basically, you're going to put this up to your nose. You're not trying to blow your brains out, people. That's not what you want to do. All this is for is to moisturize, get the mucus out of your nose and the crap that's in there, whether it's infection or pollens or whatever. Mucus is sticky. It's a protective thing. Our body makes it to prevent the membranes from drying out in our nose, but in the same, and also from infections or allergens getting inside of us. But what do? They accumulate. So we want to get rid of them. This is a higher flow system. All you do is, I recommend leaning over the sink, tucking your chin to your chest. If you don't want the stuff to go down the back of your throat, tuck it in. That closes that off, okay? Chin to chest. This goes up to your nose. You're leaning over, and you gently squeeze. Keeping your mouth open, gently squeeze. It'll run through, come out mostly out the other side, some out the same side, and maybe a little out the mouth. You switch sides, squeeze gently, release, switch. Usually I'm able to get anywhere from 4 to 5 squeezes of this gently, and this gets all that junk out of my nose. I do this morning and night. When I am feeling something coming on or I'm starting to get sick, I do it 3 times a day. This is the best thing you could ever do for your nose. When I first started doing it, I was not a fan. It feels weird. It can be uncomfortable. The key is to stick with it. Anybody and any patient I've had who's done this and stuck through it, and when I say stick through it, I mean a day and a half till you get used to it, loves it. They swear by it. I swear by it. It works. Now, saltwater wash. This is a saltwater wash. This is the nasal spray, okay? This is the generic for Nasacort, which is over the counter. There's also Rhinocort, Flonase, Fluticasone, I think Claritin has a spray. They all do. The Claritin, the Zyrtec, all that stuff, I believe, is just Fluticasone or Flonase. They're all pretty much, they're doing the same thing. They're just different formulations of anti-inflammatories, anti-allergy medicine. Okay, so you do this first, because if you do this first, followed by this, you wash the medication out of your nose. Here, you're washing your nose. If you had acne, you wash your face, then you put the medicine on. Same thing. Wash your nose out, then you use the medicine. So, shake it up. You don't have to keep this little thing, but take this off. Pull off the cap. Cross-arm technique is what I teach. Left hand goes in your right nostril. Right hand goes in your left nostril. not left on left or right on right. This is wrong. You are aiming for the nasal septum, which is where all the blood vessels and all the nerves are located, and they can bleed and get irritated, and that is not what you want. Cross arm technique, left hand, right nostril. You don't have to jab it in all the way through your nose. This is a great mist. If you have not used it for 3 or 4 days, prime it, okay? Spray it. But you see, what a great mist. That is a lot. That's a really good plume. That's going to get where it needs to. So, cross arm technique, in that side, squirt, little breath in. Switch hands. Squirt, little breath in. You're done. You don't have to taste the medicine to know that it works. If it runs down the back of your throat, do the same technique. Lean forward and do it. Diver's technique. That's the way you want to do it. Okay? I'm screwing up here. Right hand, left nostril. Left hand, right nostril. Lean forward, squirt, squirt. Little breath in. You don't have to swallow this to get it to work. Very, very effective. This is not an overnight medication, but it is very beneficial. If you are only going to do this once a day, I recommend doing it before bedtime. Saltwater wash, followed by this. The reason being is right now gravity is your friend, so everything drains down. But what happens when you lie down? Everything levels out. Okay? Same thing with the mucus, and those sinuses fill up with mucus, and that's why people can feel more congested and plugged up, and they wake up and all of a sudden they're coughing up all this junk. Well, if you can do these things before bedtime and wash out all that crap that's in your nose throughout the day, and then follow it up with an anti-inflammatory, anti-allergy, you're doing your nose a service, a really big service. Really works. This is Dr. Jack Allergy. Please feel free to comment down below. You can ask questions. If you like this, I would ask that you give me a thumbs up. You can follow me on my YouTube channel, Dr. Jack Allergy, on Twitter at hashtag Dr. Jack Allergy, and on live.me app, Dr. Jack Allergy. Thank you, and have a wonderful day.